I was raped. When I went to my doctor for a UTI, he asked me if I was sexually active. It was hard for me to say the word rape. So I told him that I had rough sex. If he had asked me if rough sex was okay with me, I would have told him no, I hated it. My doctor should have made me more comfortable talking about what happened.
Keeping in mind the time pressures facing today's professionals, talk about sexual violence can help make appointments more productive for you and your patients.
The problem is that people with intellectual and developmental disabilities experience high rates of rape, sexual assaults, and other crimes. And it is important to recognize that victims often know their attackers.
Because of these alarming rates of violence, you are likely to see patients who have experienced sexual assault. Setting the right tone is key. Ask for training if you have difficulty talking about sexual violence. Here are some suggestions. If you want to speak with your patient one-on-one, ask the caregiver to wait outside the room. If your patient discloses sexual abuse, invite a staff member to be present. Start with a friendly, comfortable tone. Address your patient and always make eye contact. Listen carefully. Allow extra time for patients to respond to your questions. Look for signs of sexual assault. If signs of abuse are present, use everyday language. Ask direct questions. Don't assume because of disability that your patient lacks comprehension. As the appointment ends, reinforce that sexual violence is never the victim's fault. Advise patients there are agencies that provide help for victims of any unwanted sex. Go over what you talked about. Ask her to describe what she heard. If your patient needs help understanding, keep charts on hand with illustrations of body parts, words, and emotional expressions. Provide information on the resources locally available to patients. Remind her that she has the right to report the abuse to police and adult protective services. Be familiar with your reporting requirements as a healthcare professional. Addressing sexual assault, while difficult to talk about, is fundamental to health and well-being.